Hey guys, Josh here, and in this video we'll be discussing the blood thinners you'll be responsible for knowing on your dental hygiene boards. So let's first kick things off by talking about Warfarin, which has the brand name Coumadin. Now, anticoagulants in general work to interfere with coagulation and help prevent a number of conditions like strokes or heart attacks. Now, Warfarin specifically is an anticoagulant that works by preventing the formation of the active form of vitamin K. Now, active vitamin K is a crucial part of the coagulation system, and although you don't need to know the specifics of the coagulation cascade, it's important to know which part of the coagulation system is affected. Now, Warfarin is monitored by the International Normalized Ratio, or INR, which we'll discuss more in a bit. Now, the adverse effects are the same general effect, which is different forms of bleeding. The important thing to know is that aspirin increases the risk of bleeding and fetal hemorrhage, while antibiotics can increase the effects of warfarin. Okay, now let's talk about another antiplatelet medication that you'll encounter, which is aspirin. Now, aspirin inhibits the enzymes cyclooxygenase 1 and 2, or COX 1 and 2, which blocks prostaglandin synthesis. Now, this prevents thromboxane A2 formation, which will inhibit platelet aggregation. Now, for a patient using aspirin, bleeding tests can be used to determine their ability to achieve hemostasis, specifically by measuring platelet function and blood clotting ability after taking the medication. Aspirin has four main effects, which are antiplatelet, analgesia, antipyretic, and anti-inflammatory, or the 4 A's, which are important to remember. Okay, now let's touch on some other direct oral anticoagulants that may show up on your dental hygiene boards. We have clopidogrel or Plavix, which affects platelet function, and patients may be advised to discontinue its use before dental work. There's heparin, which is a common anticoagulant used for hospitalized patients. And we have apixaban or Eliquis and rivaroxaban or Xarelto, which are some other anticoagulant names to keep in mind. And with that, let's dive a bit further into warfarin and INR. Again, warfarin, which is sold under the brand name Coumadin, is an anticoagulant used to inhibit intrinsic and extrinsic vitamin K-dependent clotting factors, which include factors 2, 7, 9, and 10. Now, let's say you have a patient who's taking anticoagulants like warfarin, and you want to know if it's safe to proceed with a procedure. Here we would turn to the International Normalized Ratio, or INR, which is a blood test that measures the clotting tendency of blood. Keep in mind that the INR is a standardized calculation based on prothrombin time, or PT, which is the time required for a blood sample to clot. PT measures the time in seconds, while INR gives a standardized ratio to interpret that time effectively across different testing environments. And in general, the target INR is usually between 2 and 3. Now, you should also be aware of for your boards that warfarin can be used with clopidogrel, but you should be aware of the increased risk of bleeding. Now, if INR is too low, blood clots are more likely, and if INR is too high, bleeding side effects are more likely. However, warfarin and alcohol have a complex interaction that can affect the efficacy and safety of warfarin therapy. Specifically, it can acutely increase bleeding risk, and chronically, it can actually increase clotting risk. So it's important to encourage patients to limit alcohol consumption whenever they're taking warfarin. Now, you may also want to avoid prescribing ibuprofen, since ibuprofen is an NSAID which can interfere with blood clotting by inhibiting platelet function through the COX inhibition pathway, significantly increasing bleeding risk. And caution should also be used when the patient is taking oral contraceptives, since this can actually make clotting more likely, as well as increase certain liver enzymes that can decrease INR. Lastly, it's also important to remember that heparin is monitored by PTT, but warfarin is monitored by INR. And with that, let's try our first practice problem. This question asks, what is the best course of action for a patient on warfarin who needs extractions but has an INR of 3.8? Now, I'll give you a minute to pause and think about your answer. Now, in practice, if the INR is 3.8, it's outside of the ideal safe range of 2 to 3, so you should refer to their physician for guidance, meaning the correct answer is option A. The physician may adjust the anticoagulant therapy, like reduce warfarin dose or temporarily hold it, and provide specific instructions on how to safely proceed with the dental extraction. If the physician allows the procedure to go forward, it's important to ensure appropriate bleeding control measures are in place. Okay, now let's try our second practice problem. In this problem, we have a 45-year-old male with the chief complaint that their lower right teeth are hurting. The patient has a history of chronic atrial fibrillation, class 1 obesity, hypertension, and occasional alcohol use. They're taking warfarin, lisinopril, and acetaminophen. Now, from our exam, we find that the patient needs extractions of teeth number 30 and 31, but their INR has not been checked yet. Now, the question itself reads, given the patient's ongoing warfarin therapy, each of the following pain medications is appropriate except one. We're asked which one is the exception. Now, I'll give you a minute to pause and think about your answer. So here the correct answer is going to be option A, ibuprofen. Now ibuprofen and other NSAIDs should be avoided because of their potential to increase INR and the risk of bleeding. Also, we should try to advise a patient to limit their alcohol use, since this could actually decrease their INR and lead to an increased risk of blood clots. Okay guys, we're almost done. Let's try our last practice problem. In this problem, we have a 68-year-old female who's interested in getting implants. They have a background of dental anxiety and they have an INR of 2.1. Now for medications, they're taking hydrochlorothiazide, clonazepam, and aspirin. And from our exam, we find that they need extractions of teeth number 14 and 15. Now the question itself asks which of the following treatment modifications is required for this patient prior to the extraction of teeth number 14 and 15. Again, I'll give you a minute to pause and think about your answer. So since their INR of 2.1 is within the acceptable range of 2 to 3, there are no treatment modifications necessary, meaning the correct answer is option D. But remember, even if modifications were necessary, you should not alter the patient's medications yourself. Instead, you should consult the patient's cardiologist or primary care physician first. And with that, we are done. As always, here's a summary slide with a list of high yield points that we went over in this video. Thanks for watching, guys, and I'll see you next time.